took it as an opportunity. I always involve our CEC as much as possible. This makes me a full-time CEC manager. Like, I would require all applicants for locally funded teachers and office workers to undergo training in our CEC. Without passing the examination after the training or without the certificate, then I will not approve their appointments. So, where I am an advocate of gender equality, digital literacy, and cancer prevention. I always invite people from all walks of life to visit the CEC and make it part of their lives. Our trainees are among our advocates in promoting their own stories, just like Divina Lopera, who was one of the 12 success stories of Intel. And another one here is Mr. Redwin Pasoot. He is with me right now. Please stand. Who is supposedly our utility personnel. However, after the first batch of training using the Intel Easy Steps, he is now one of our trainers at Mauban e-Learningville. Next slide, please. Okay. So, yan po yung aming CEC noong 2012. Next slide, please. And these are the services that we offered. So what I want to share more with you today is that we can always move on as one if we engage ourselves into a public and private partnership. And we are doing this in Mauban CEC. DOST gave us a community billboard for farming and disaster management as the center of information and communication. And most importantly, our CEC is helping our rural health unit. We collaborated with the Cancer Institute Foundation, an affiliate of the University of the Philippines, Manila, for the Moving as One project and the CCAP network and with Quezon Power Plant. Mayor Fernando Llamas, together with the Sangguniang Bayan and the core group of the Mauban e-Learningville, signed a memorandum of agreement to tie up our CEC with the Moving as One program. Why? So, eto na po yung aming CEC. Yung e-counseling room, which is also my office, serves also as the e-counseling room. And the person seated there using the laptop is one of our patients. Humingi naman po ako ng permiso na kung pwedeng ma-post yung kanyang picture. And this one is our meetings with the doctors at UPPGH. Next, please. And now we're still aiming high. To save more lives. Next, please. Based from NSO Census of Population and Housing in 2010, we have 61,141 constituents in Mauban. And to date, it is estimated that about 64,000 people are now living in Mauban, and about 45% of that are women. And we discovered that number 9 ang cancer sa cause of death in our municipality. So there are different kinds of like breast cancer, lung cancer, liver, cervical, and colon. So cancer is a leading cause of death worldwide, amounting to 7.6 million deaths, around 13% of all deaths in 2008. So sabi po ng World Health Organization, cancer is still ranked 3rd in the list of leading causes of death in the country in 2010. 50% of Filipinos die without seeing a doctor, and half of those doctors who have specialization are practicing in Manila. So to address this problem, next slide please. Our Moving as One project is one of our solutions. Next again. We found out that these are the health workers in our municipality from our rural health unit and the hospital. There are only 20 nurses, 24 midwives, 4 medtech, 2 dentists, 162 barangay health workers, 5 physicians, and 1 sanitary inspector, plus 2 pediatrician and 1 physician, general practitioner from private clinics. So with this small number, and they don't have so much specialization, some people, next slide please, some people would think more than 5 times to go to a doctor in the nearest hospital because they would need a transportation cost of 130 pesos plus food and the abala. So a patient would more or less spend 1,000 pesos to see a doctor in the nearest city. It is more than half sacrificed for ordinary citizen, and they will not spend it for checkup unless they are in severe pain or there is bleeding in cases of women. Tama po ba ako doon? Kasi di ba, sa budget sa family, we would prioritize food, education, housing. But for the health of the mothers and the father, madalas kung kaya pa, titiisin na lang. So to bring closer to our community with the health professionals, we launched our online counseling or consultation last March 22. Dr. Cecilia Llave is, so in partnership with UPPGH, next please. So Dr. Cecilia Llave, one at the middle of my mayor and the mayora, and our mayor committed to the Moving as One with Secretary Ona. They pinned the cancer prevention for the partnership. And then we had the signing of the MOA. This is our online consultation room. We had a launching and the e-counseling last March. So before that, we had a series of meeting with PGH Cancer Institute. In the picture up there is Dr. Llave, our MHO, and our SB Women on Health. And then below there is the picture of the e-learning core group during one of our meetings approving the inclusion of the online consultation at e-learningville. Next, please. So to answer the program on Global Call for Action to Save Lives, Dr. Cecilia Llave, who is always available online doctor with specialization on obstetrics and gynecology oncology, she is also an affiliate at Asian Hospital. We have scheduled consultation from Monday to Friday using a Skype video call in our CEC. Of course, we respect the confidentiality of the during the online consultation, so they use a headphone or a headset, and the patient is all alone in the room or with their relatives at times. Then, from March to date, we already had 56 patients, and 20 of them got free cervical cancer vaccination. This may sound a small figure, but this is because some people are still hesitant to go to the online consultation. They feel awkward to talking to the computer for their consultation. Of course, this is new, so ganun talaga po. But our municipal health officer right now is considering to expand this kind of consultation for our constituents living in the coastal barangays. Kasi sometimes it's very difficult to come to the town proper because of big waves. Mga kasing laki lang naman po ng bahay, yung wave, minsan, siguro sa isang taon, mga 6 na buwan na ganon. So that's the considerations. So we have referral systems. We use the laboratory in our rural health unit and send the results to our online doctor via email po. Sometimes we bring our patients to the district hospitals if they needed immediate treatments, or to the provincial hospitals, and at some other times to PGH. And since they were already considered patients of PGH through the online consultation, they can easily get